All right, everyone. You know what time it is. It is time for another great interview. Tonight, I am Marwan Cameron, and this is The Conduit. All right, everyone. It is July 1, 2021. It is 72 degrees in Kitsap County. It's a beautiful day, hazy, overcast, but it is not triple digits. So I will take that. Much better than being so hot. That was miserable. And I do not like the heat, I must say. But then I don't like the snow either. So, I guess there's no pleasing me. It's just what it is, right? We're never happy. We do need some water, though. So that would be good if we have that. As I said tonight, my guest is Dr. Gib Morrow. So we're going to go ahead and let him in the room here in just a second. Very excited to have him with us this evening to talk about all things COVID and the vaccine. So especially with, July 4th getting ready to come about, I think it's just good to kind of touch base and see what's going on. And, many of you may not even have met him. So I think it's a good idea to, have that opportunity. So with no further ado, let me go ahead and get the doc in the room. How you doing there today, Dr. Morrow?
I'm good, Marwan. Thanks for having me.
Yeah, I appreciate you being willing to come on. And, that's awesome. We haven't met in person, but, I've been in some Zoom meetings with public health and, you come off as a very friendly person, very knowledgeable, and just wanted to help the community. So that's really awesome. If you would you just let everyone know, who you are? What do you do? You just came to Kitsap County pretty recently, right?
Yeah, so I'm a general internist. That means I do primary care internal medicine. I started my career in the Harborview emergency room, first rotation after I graduated from med school back in 1990. And I've done this and that and the other thing for the course of what's it been, 30 something years. And as of July 27th last year, I remember the day clearly. I showed up in Kitsap and took over the health officer position. And it's been quite a wild ride since then, as you can all imagine, and you have all I know experience. So I'm happy to be here. I think Kitsap feels a lot like home. I spent most of my practice time in Bellingham after I graduated from UW residency program, and the communities are a lot alike in a lot of ways. It feels comfortable. There's water everywhere. It's beautiful. It's down to earth. It's got an active and engaged set of folks, and I'm happy to be here and happy to be serving with the health district, which I consider to be just a top-rate organization. So, and thanks for having me. I think your work in terms of trying to get information out to different sectors of the community has really been incredibly valuable. We really appreciate it, and I'm grateful to have the opportunity to talk to you this evening.
So appreciate it. Thank you so much. Can you tell us what does a health officer do?
Mostly putting out fires, today was looking at some stuff from across the region, just showing a lot of interesting strain on the hospital system. Over this last weekend, there was just a big spike in emergency department visits, hospital admissions. Read in the paper about 4 heat-related deaths. If it's not one thing, it's another. Last week there was an outbreak of what was probably norovirus in a nursing facility. Mostly it's been kind of COVID, and more COVID. But, I think one of the real top priorities in public health in general is to identify care system. Where are those areas where we aren't meeting the community need, or where are those areas where we're kind of falling down on the job, or where are those disparities that we hear talked about in terms of access to healthcare, outcomes, in terms of just disproportionate impacts on different communities and different neighborhoods. And so a lot of it is looking at the epidemiology, the sort of where is the disease happening, why is it happening, which communities are being hit the hardest, and what, if anything, can we do to try to minimize those disparities. We spend a whole lot of money in healthcare in this country, 3+ times what most other developed countries spend, and yet our outcomes just aren't that great. And interestingly, one of the big drivers of that are the economic disparities, in the way that different groups get just hit harder than others by certain things. And we've certainly seen that, with COVID. A lot of the work within the health district and we're trying to make sure we have quick and agile and responsive systems to deal with outbreaks, to know where they're happening and what can we do to stop them, trying to understand really those outcomes related to everything from chronic diseases to cancers to communicable diseases. It's all over the map. A lot also of what the health district does is those things like food safety, restaurant inspections, water safety. We get a call about an algae bloom in Horseshoe Lake, and somebody goes out there and dips a cup in the lake and sends it off to the lab to see if there are toxins present, and hopefully do that before the dogs start dying and before the deer drink too much water. But there's endless variety, which is for me why I really enjoy doing the work, and a lot of it is trying to reach out across the community and connect with different organizations, to understand what are those community-based organizations that are doing the lion's share of the work, to be honest with you. How do we harness the energy and the effort to really achieve what all of us want to achieve at the end of the day, which is a better, healthier, safer community. And the other part of the things that we do are looking into those really kind of what I would, and a lot of people call those upstream contributors to health outcomes. Transportation, road safety, things like housing and public transportation. And, really, those are the kind of things that are the big drivers of health outcomes. We need to have a good, healthy, solid primary care and healthcare system. But really, at the end of the day, a lot of those more upstream factors drive the outcomes more than anything else. So there's endless variety, never a dull moment. Really fascinating for me to be part of it.
I was just getting ready to say that. It sounds like you don't have a dull moment. It's always something going on, and it's multiple things happening all at the same time. Well, we're glad you're here, and I've seen an impact in public health since you've come aboard, and I think it's been tremendously positive and inclusive. So we definitely appreciate that. But let me ask you a few questions, if you don't mind. The FDA had a warning sheet for heart inflammation with the Pfizer and the Moderna. And as the age group comes younger and younger to become vaccinated, what are your thoughts on that?
Yeah, so you're talking about this, what is considered to be a probable association between the RNA vaccines and a condition that's called myocarditis. And myocarditis basically means an inflammation of the heart muscle. So, if you go out and you pump iron and you get sore muscles, your muscles are sore, they're inflamed. You may even develop an elevation of blood tests that show some muscle injury. And the same thing can happen to any muscle in the body. The heart's a muscle, as we know. It's a smooth muscle, and it's kind of set to tick away at a regular interval. It's the one muscle you don't want to injure or hurt. But there appears to be a probable but very, very rare association with those mRNA vaccines with this condition that's called myocarditis that indicates some inflammation of the heart muscle. So the symptoms of that typically are going to be chest discomfort, maybe shortness of breath, maybe some palpitations or heart irregularity, maybe some fatigue. And we know that COVID-19 causes one heck of a lot of heart muscle damage. There was a study back a year ago, August, that showed, and this was in Germany, and it was done using cardiac MRI scanning techniques, and it showed really high. It was over 50. It might have been in mid 60% rate of some degree of cardiac abnormality on younger athletes who got COVID infection, COVID-19, and who subsequently, even many of whom were asymptomatic, they still were able to show this condition of cardiac abnormality on that very sensitive way of looking at it. But there have been additional studies that show with COVID-19 that a lot of those cases, and it's somewhere, in the 7.5% range on one study, 2.5 on another. So it's a little bit all over the map, and it really depends on how you assess for it. But COVID-19 causes a lot of myocarditis, and now we've got this condition that's rare. It's it appears to be a little bit more likely of an issue in younger males than older folks, but it can certainly happen. And what we've done is we've asked everybody who gets a COVID-19 mRNA vaccine to report and self-report any symptoms through this national database that's called VAERS. And there were some cases that cropped up. Oregon saw them, Washington saw them. We aggressively, almost went looking for them. And when you do that, you find stuff, and everybody knows that any drug can do anything to any person at any time. There were about, I think I've heard of 4 cases in Kitsap, 2 of which were just telephone calls to their doc after the fact saying, hey, I kind of felt this way after I had my vaccine. And I think it might've been myocarditis, and I'm doing fine now. They didn't bother going to the doc, and we counted those. But there were a couple, again, younger males, at least one of whom got admitted to the hospital and, had a bump in his cardiac enzymes. That's one of those blood tests that we can do to pick up inflammation of a muscle, and ultimately, spent about a day in the hospital and was discharged. So it happens. It's probably associated. It's still one of these situations where everybody, every group, every respected organization in healthcare is still strongly recommending that people go ahead and get vaccinated. You're just a whole lot more likely to get that particular complication after COVID-19. And you're also more likely to get all the other stuff that people get with COVID-19. But the rates are rare, again, for those people who are in that, I think it's age 19 to 40, they're looking at about 8 per million after mRNA vaccines. So,
it's a tiny amount.
Yeah, so we had our fair share already. Is how I crunched the numbers. But the CDC and Health and Human Services and the American Academy of Family Practice and the American Association of Pediatrics, the American Heart Association, the American College of OB-GYN, the American College of Physicians, which is the professional society that I belong to as an internist, and the ID Society, Infectious Disease Society of America, all say that, the facts are clear. It's an extremely rare side effect. Exceedingly small number of folks get it, and that they unequivocally recommend getting vaccinated right away if you haven't already, and that this particular issue is rare. Most people have responded just to minimal treatment with rest and maybe an ibuprofen or two and some fluids, and that the best way to get yourself protected and your loved ones and your community and get back to normal is to get yourself vaccinated. So it's something that we know about. We have sent out a number of different provider advisories to the medical community, just making sure that they know exactly, to be looking for it. You only see what you know, right? And to understand how to evaluate for it and how to treat it and how to just get people that experience this very, very rare event safely through it. And it, again, is not a reason not to get vaccinated. So,
I think that's really helpful for you to, state that, because we don't often hear that it's like, look, you can still have these, this complication just from getting COVID. So, it's not like, oh, well, if I get the vaccine, then this could happen. It's like, no, it's probably more likely that it's going to happen if you get COVID. So you're still better off getting the vaccine. And as you know, I just had my second shot of the vaccine, Moderna. I think it's been almost 4 weeks now. So, which is great. Has it been 4 weeks, maybe 2 weeks past my, you get the second vaccine. I'm 2 weeks past that point. So I'm feeling pretty good, but it really is important to do that daily check-in. And so I was doing that through the CDC so that I can, hopefully be a help, so they can, capture whatever might be happening sooner than later. It will help other people. So I definitely encourage people to do that for sure. Should parents encourage kids to take the J&J? I mean, it's just one shot. It's the efficacy isn't as great as the Moderna or the Pfizer. What's your thoughts on that?
Well, the J&J is a great vaccine, and it's got a lot of just usefulness, being the one and done approach. A lot of people love that. I mean, folks have fear of needles and just, the RNA thing, I think, spooks some folks away, although it really should not. And we can talk about that in a moment if you'd like. But the Johnson & Johnson is a really good is a good option for a lot of people. It's not currently licensed or authorized for people under 18, so it's not quite ready for kids quite yet. But again, it would be a good choice, I think, for kids. They're studying it right now, and I believe 16 and 17-year-olds, and then they've got plans rolling into the fall to look at it for 6 and up, and then down to 2 years of age. So I think we're going to see those approvals start to roll in as we gather some data. I know that they've already got folks lined up to start testing those. They've got a few thousand study participants lined up, and in all likelihood, it'll be an option. I wouldn't wait for it. The best vaccine to get is the one you can get now. And so if you're 12 years old, Pfizer is the one you want to get. That's the one I got. I actually got my first dose on December 31st. So I mean, it's kind of miraculous that that we were able to roll those out in a lot of ways. But there was one heck of a lot of work that went into developing that technology, to studying that technology. A lot of which was done at the University of Washington, which is just one of the best places on the planet for, not only public health, but research and development. And the concept behind those RNA vaccines is just really kind of brilliant. And I think they're going to be increasingly useful for a lot of other things, maybe even things that just we haven't been able to make vaccine preventable yet. But the fact that COVID is as vaccine preventable as it is really has been a stroke of luck, and just the fact of having those vaccines has not only been a stroke of luck, but it's been a tremendous amount of ground research and development and investment, and it was everybody's top priority to figure out a way to end this beastly disease that just really, is still tearing apart, so many different parts of the world. We're at a little bit of a lull right now, but I'll tell you what, the levels are flat and stable. They're at levels that are higher pretty much than any other time, other than a brief spike back last July and August. That was happening right when I arrived on the scene here in Kitsap. And they're higher now than they were before we kind of went into that big sort of winter holiday surge that really was just such a rough thing to see. But the disease is still here. We'll see how it all plays out. I mean, a lot of different competing forces, between getting the vaccinations rolled out and just reopening of society, getting people back together a little bit. We'll see what happens. But the fact that these vaccines work as well as they do should make you feel great about having had yours. Congratulations on that, Marwan. I'm happy for you, and I'm really happy for everybody that's made that choice to protect themselves and their family and help get things back open and running again.
Wow, that's awesome. We want to give a shout out to Kitsap Strong. They're on, watching us right now, and they say, welcome, Dr. Gibb. Thanks for being accessible in this forum. We frequently say connection is important in rebuilding trust. How do you feel about KPHD's efforts in bridging relationships to seek input from the most impacted?
I think we're doing our best. You could always do better, I suppose. We've started this equity collaborative group, which is all about trying to build those ties and establish those relationships and build trust and build trusted messengers like you and like Kitsap Strong and like Kayak and so many of those organizations that are just really connected to and respected by their communities. As an old white guy, I don't give myself a whole lot of authority in terms of being able to convince people to get vaccinated, but to the extent that I can, reach out to whoever's interested in willing to put themselves out on the line and kind of help their communities get through this as safely and quickly as possible. I think that's what it's really all about. So thank you, Kitsap Strong. I'm appreciative of all the work that you do and so many other different groups. And if there are ways that we can improve, I'd sure like to hear about it. As we passed at our health board meeting with the help of Dr. Lillian Robertson and all of you, a declaration of racism as a public health crisis, which it truly is. I think we're seeing acknowledgement, with the passage of a bill making Juneteenth a national holiday. Congratulations to all of us. I'm looking forward to, celebrating that every year and thinking about it in a very, very meaningful fashion. The fact that we had institutionalized chattel slavery in this country 160 or 70 years ago. That piece is passed, but there are still really significant structural issues that continue to impact all of our lives. And you see it in terms of housing and, law enforcement and things within the school systems and so many different areas that people don't necessarily recognize, or perhaps, many of us don't, and we're learning together, but trying to, bridge those gaps and build those ties and build those connections. And I think that that's a essential piece of what public health is all about. So thank you, Kitsap Strong, for your question. And if you got other feedback or specific recommendations, I'm all ears.
All right. No, and I want to echo your sentiment for sure. We got a few more questions for you, but they're kind of coming in here pretty quick. So, what is the guidance for people who received the Johnson & Johnson?
So 2 weeks after your 1 dose of Johnson & Johnson, you are fully vaccinated. My guidance to you is go get at least 2 more people to go get vaccinated. If all of us are vaccinated, get 2 more people to get vaccinated. We'll get everybody vaccinated. And really, it's only just one. If we've got 50% of us vaccinated, we all drag in 1 more person and get a shot in their arm. If it's Johnson & Johnson, or 2 shots, if it's Pfizer or Moderna, we win the game. So, these last couple of yards to get into the end zone are pretty crucial. But don't throw your masks away quite yet, but you're safe. I mean, if you've been vaccinated, you're safe. You're less likely to give it to your family members. You're way less likely to get sick. If you're 45 to 65 years old, you are 1/20th as likely to wind up in the hospital as if you are unvaccinated. So so folks who are unvaccinated are 20 times more likely to wind up in the hospital. For that age group, they're 15% or 15 times more likely to wind up in the hospital if they're over 65. So, the vaccines don't work quite as effectively in the older folks, and they don't work quite as well in people who are immunosuppressed. Thinking about people with transplant, prior organ transplant, or who may be on medication for inflammatory bowel disease or Crohn's or rheumatoid arthritis or lupus. I mean, even folks that have asthma or emphysema. So there are a lot of people that have underlying health conditions for which these vaccines may not be as effective as they are for younger, healthier folks. So again, it's just about all of us getting vaccinated, and the more that do it, the safer everybody else becomes, and the safer the whole community becomes. And so I don't even remember what your question was.
No worries. You addressed it. Let me combine 2 or 3 together because our time is short. We've got this Delta, that's kind of coming around. We're seeing it across the world, and it's here in the United States. And the CDC isn't 100% sure about the efficacy of the vaccine against some new strains. And so, of course, you were just kind of reflecting on, people should still become vaccinated, and, 1/20th. And I mean, those are really powerful numbers that I don't think, kind of gets pushed out there, but there's so much noise to kind of sift through. Can you kind of reflect on, Kitsap's vaccination levels and the Delta variant, the presence here in the county?
Yeah. So the mRNA vaccines, the 2-dose series, appears to be very effective against that Delta variant. So, to make a complicated disease even more complicated, all of these variants of concern they're now in their 3rd name. There was there were the place names, which really are problematic and kind of, may stigmatize certain parts of the world. But the Delta variant is the one that ripped through India and has been ripping through India this spring, and just ways that I think were really devastating and shocking, and just so sad to see. Just the people, not having access to healthcare or oxygen or just basic things, and that Delta variant is also known as B.1.617.2, now Delta variant, and that one is the most significant currently circulating variant of concern. So the UK variant, also known as Alpha or B117, that's the one that ripped through the UK and then got into our country. It's fascinating to see, when they do those genomic sequencing and surveillance studies, when they run those kinds of tests, that UK variant went from just a couple percent of the total numbers to 80+% here in this country over about 2 months. It did that in the UK even faster. It just elbowed out all its competitor species. I mean, the more transmissible variants are the ones that start to kind of take over. And unfortunately, for both the UK variant and for the Delta variant, not only were they more transmissible, but they cause more significant disease. And we're seeing that right now in Kitsap. I'm personally reviewing death certificates, and it's really, really, really sad for me to see these people who are oftentimes younger than I am, without pre-existing health issues, who get sick, and they get sick quickly and they die. It's happening. It's happening right here. They are all unvaccinated, and we're not seeing people hospitalized who are vaccinated. And the mRNA vaccines are good. There's good, solid protection against that Delta variant. So I think that's a really important reason to get vaccinated, is, not only to keep yourself healthy, but to stop the transmission of that, and keep yourself from inadvertently giving it to somebody else. And that's the spookiest thing about this disease, is the number of people who are transmitting it without even knowing they're doing it. And one thing that we are seeing, and this has just been a recurring theme, and this is something that I've seen in healthcare workers, just, people who are medically sophisticated, oftentimes just don't recognize that what they're actually experiencing is COVID infection. They get the sniffles, the sore throat, some congestion. It's not all about loss of smell and taste and high fever or shortness of breath. Oftentimes just those minimal symptoms that you might think are your allergies acting up, or maybe that wildfire in British Columbia irritating your eyes. Lo and behold, it's COVID, and a lot of people have absolutely no symptoms whatsoever. They wind up spreading it on to somebody else. Next thing, there's an outbreak and the school's closed down. So please get vaccinated. I'm going to keep hammering on that request, but the vaccines work against Delta variant.
All right, that is awesome. Any guidance into the 4th of July and on through the summer?
Spend a lot of time outside. Take care of yourself. We're in a weird place right now. We're kind of coming out of this just restricted, isolated mode. This has impacted people a lot of different ways, and there are people who have suffered through what we call the disaster cascade. That's the loss of a job or a loss of a family member, compounded by personally getting sick, followed by, maybe losing your, loved one or your home. There are those people who have been impacted. There are others who have skated by and think the whole thing is unreal, and we're all coming out of this with, kind of different basic experiences, and we're going into these open summer months. We're going to be coming into close contact with each other. We all think we have the right answer to the whole thing. From my perspective as a public health professional, it's err on the side of safety. When in doubt, just be cautious, but have fun, get some exercise, be outdoors, be kind to each other. Exercise a little bit of extra tolerance, because none of us really know what those other people that we're encountering have been going through over the last year and a half, but it probably hasn't been all that particularly pleasant for any of them. So, I'm in last but not least, and probably first and last both, if you're not vaccinated, please get your vaccine. You will not regret it. You might have a sore arm for a day or two. You might feel a little bit off, but at the end of the day, you're doing the right thing, and you're doing the right thing not only for your community, but for your loved ones and your family, and for yourself, for yourselves.
Absolutely. Well, I want to personally thank you and all of your staff at Kitsap Public Health. It is, you had an influence on me becoming vaccinated, as you were a trusted source for me gathering information and making the decision to become vaccinated. I actually have sarcoidosis, and I've got some other comorbidities, and I had to weigh it. And I was, listening to the information and taking it in, and no one on my staff or myself wanted to become vaccinated. But at some point, it made more sense to be vaccinated than not. And after that, folks started following through. So now my entire board is vaccinated, and many of our staff are now vaccinated too, or waiting to get their second shot. Poverty management was just telling the story. They had a pop-up event this last week, and that kind of spurred some of them to start the process, and so just on and on it goes. And it really does make a big difference to have people that you can trust and be accessible, as Kitsap Strong was saying. So we really do want to say we thank you and appreciate you for sure.
Yeah, and there are some good reasons that people have, whether it's just accessibility to getting vaccinated, or, I think it's just trying to make sure that people have the right information to make the right decision and make it as easy as we possibly can for people to get vaccinated. Yeah, at the end of the day, it's just absolutely the right thing for all of us to do that are able to do it. Yeah, we'll get through this. We'll get through this, and I'm looking forward to a bright future, and to starting to tackle some of those other issues that we all want to try to get a top of together. So thank you very much for having me, Marwan. Really enjoyed talking to you, and happy to do it at any point. So. And that's true for other folks out there. If you have questions, we want to make sure they get answered through the health district. So we may not always tell you what you want to hear, but we'll be honest with you and get you the right information and point you to the right sources. So,
and they can go to kcowa.us/vaccine to get updates, which is connected to your website, correct?
Yes. Yeah. Is that just Google Kitsap Public Health District. And spend some time poking around. Go into some of the dashboards. We've got disease rates. We've got the vaccine clinics. We've got COVID rates by race and ethnicity and age and geographic region. We know who's given all the vaccines, where you can get them, and there's so much more on there. There are provider alerts, so those are the messages that we send out to the local medical community. You can watch our health board meetings if you are experiencing insomnia. I watch myself here, but anyway, yeah, thank you.
We appreciate you, Dr. Gib Morrow. That is Dr. Gib Morrow, everyone, from Kitsap Public Health District. We appreciate him coming on and again providing that information for us. And it's great that our public health is so accessible to us here in this county. It is definitely a blessing for us. I am Marwan Cameron. This is the Conduit. And until next time, please be safe, stay hydrated, enjoy the holiday as it is coming up real soon. All right. Until next time.